This is the, oh, darn, of course. Yeah.
It's on. See, you just gotta flicker it and then let it rest.
Well, maybe it'll, you can still see. Yeah, it's alright. Okay. It's not as, it's on your phone. No. Oh, hello.
It's a spirit.
Yes. Alright. So, this is the anterior compartment, right? Okay. So, in the anterior compartment, there are 4 muscles. This one would be tibialis anterior. Okay. And it's going to come down, and its distal attachment is going to be on the plantar surface of the base of the first metatarsal and the medial cuneiform. All right. Then we have extensor hallucis longus. All right. And so you can see its muscle belly here, and it's going to go all the way out to the great toe. Oh, we got little hammers there. Okay. And then
Hold on.
we've got extensor digitorum longus, right here. And then coming off of the extensor digitorum longus, the muscle belly, and going out here to the dorsal aspect of the base of the fifth metatarsal, that is your peroneus tertius. All right. So the anterior compartment is innervated by what nerve? Deep peroneal. Yeah, and this one, what you can see, and what artery supplies it?
Anterior tibial.
Anterior tibial, yeah. So what you can see here is here's your anterior tibial artery, and then in here is your deep peroneal or deep fibular nerve. Okay? So they're traveling together. You can kind of see it all the way up in here, just anterior to the interosseous membrane. Okay? Then we know what happens. In front of the ankle, the tibia or the anterior tibial artery becomes the dorsalis pedis artery. Okay? And then the deep fibular nerve, after it innervates the anterior compartment, it does what? Becomes cutaneous to where? Just to the first web space. You can see this go all the way down, and you can see it. Oh, hello. There, you can see it branching there, and just supplying that first web space. Okay, so that's anterior compartment. All right. Then, if we look over here at lateral compartment, there should be how many muscles? 2. Right, and so the more proximal of the 2 is the fibularis longus. And then the deeper one, this one's hard to show, but it's fibularis brevis. All right? And longus, we're going to know, they're both going to go posterior to the lateral malleolus. All right? The longus is going to come around, and it's going to go deep on the bottom of the foot. Remember, it goes through the tunnel on the cuboid, and then it comes over to, and it attaches medially. I don't think you can see it, but it attaches medially here, on that similar area as to where the tibialis anterior attaches, right? In terms of the base of the proximal, the first metatarsal and the medial cuneiform. Okay, the fibularis brevis is this is its tendon. You can see right here, which comes down and attaches at the base of that fifth metatarsal. Okay, more on the lateral aspect versus peroneus or fibularis tertius attaches on the dorsal aspect. All right, so here's the tendon of the peroneus brevis. Okay, they need to clean this up a little more so you can actually see those 2. And so what supplies the lateral compartment? Superficial fibular, and you can see superficial fibular nerve right here. All right, so it supplied the lateral compartment, and then it becomes cutaneous, right? Cutaneous to what area? To the yes, it's going to do the lower part of the lateral leg. All right. Upper part is the upper lateral cutaneous nerve of the leg, which is a branch off the common fibular. All right. So it's going to do the lower lateral part, and then the rest of the dorsum of the foot. Now this one was cut, so you can't see all that. Okay, but you can see the rest of the dorsum of the foot. Okay. All right. Oh, they've got theirs on that side. All right.
You said the rest of that nerve innervates the dorsum of the foot?
Yes. Yep. Yeah. Good. The cutaneous innervation for the rest of the foot, except for that, the dorsum of the foot, except for that first web space. Okay? All right? So that's anterior and lateral compartments. All right? You can turn it off for a second.